Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So in this video, we're going to talk about anti-intussive medication, mast cell stabilizer, anticholinergic, expectorants, and antihistamine medication. So with our anti-intussive medication, examples include benzonatate, codeine, and dextromethorphan. They're used to treat cough, and they all work differently. So with benzonatate, it works by having an anesthetic effect on the vagal nerve receptors in the airway. Some side effects include sedation, constipation, as well as GI upset, because we know anesthesia messes or slows down our CNS. Codeine works by binding to the opioid receptors in the CNS, and it decreases the patient's cough reflex. And since we are messing with the CNS, our side effects will be everything is slowing down, right? So we'll have sedation, respiratory depression, hypotension, constipation, as well as GI upset. So with patients who have asthma or COPD, and they are on this medication, we really need to watch them closely because of this respiratory depression side effect. Dextromethorphan, it works by suppressing the cough reflex in the medulla oblongata. Some side effects include dizziness, and the possibility of sedation is very low. And the only way you could get sedation effects is if you have high doses of dextromethorphan. Our next medication is our mast cell stabilizers, and this medication, you'll see it in a lot of questions in relevance to asthma. So you really need to know how it works, its mode of action, and when you take it. So how does it work? It blocks mast swelling. How? By blocking the histamine response, which inflames the body. Okay? It is used for asthma prevention or asthma prevention, like activity asthma prevention, and it's used before sports or exercise. It's taken 10 to 15 minutes prior to a physical activity. Next medication is our anticholinergic medication. And with our anticholinergic medication, it could be in an inhaler form, puff, or it could be administered nasally. And when I say nasally, I mean nebulizer treatment. So examples include ipratropium. It's used for COPD patient, for rhinitis, and we know rhinitis is like a congestion like running nose, as well as asthma. But with asthma, it's kind of off-label use. It can be used alone or in combination with albuterol. And if it's combined with albuterol as one, it's known as a donep. That's how the medication is called. Its mode of action, it blocks acetylcholine receptors in the airways, smooth muscle, causing bronchodilation. And remember, acetylcholine, it's what causes the muscles to have their fluid, right? Moisture. And since we are blocking acetylcholine, what are our side effects? It's drying side effects. So you're going to have a dry mouth. You're going to get constipated. You're going to have dry eyes because you're drying up. Anywhere you have smooth muscles dries up. The medication also has a bitter taste and also causes that nasal or throat irritation, drying effect. With this medication, we always advise our patient to do what? Increase the fluid intake due to the drying effect, of course, and they could suck on a hard candy. And for Duoneb, it's contraindicated for patients with peanut allergy. And for acetylcholine medication as a whole, it's contraindicated for our glaucoma patients, our urinary retention patients, our BPH patient, our bowel obstruction patient. And what is it with all these conditions or diseases? It's like they're already having drying issues, so we don't want to dry them more. For tiotropium capsules, these capsules are not to be swallowed. They are actually placed in a device, and this device is what you're gonna inhale so it can inhale the medication into you. Okay? They are long-acting bronchodilators. This anticholinergic, it's long-acting. It's not immediate. Expectorants. Guaifenesin is our example. It's used for a non-productive cough associated with some kind of a respiratory infection. How does it work? It works by reducing viscosity, and we talked about viscosity. Viscosity is how a liquid moves. When something is viscous, it means it's thick. It's not moving fast. So, as I gave you the example, when let's pour glue and let's pour water on a flat surface, they'll all run. But water will run faster than the glue. So the glue is viscous. Water is less viscous. Okay, so this medication works by reducing viscosity of the secretions. It helps thin the secretions, right? And makes your cough more productive. So patients who have this thick congestion and they can't bring out that mucus, so this medication helps them bring it up. So side effects include GI upset and dizziness. We teach patients on this medication to increase or to take this medication with a full glass of water. Why? Because when patients have thick mucus, viscous mucus, we increase the fluid intake to thin down, to help in the thinning down of this mucus. Our last medication that we're going to talk about in our respiratory system is our antihistamine. And what we need to know is that antihistamine are in two generations. There is our first antihistamine gen and the second gen antihistamine. So examples for first gen include Benadryl. Our second gen examples are Claritin and Zytac. What are their uses? They are used for allergic symptoms, for example, rhinitis, which is running nose, itchy eyes or sneezing, as well as motion sickness and hives. When you're having like a hive or an allergic reaction, they're like, take Benadryl. A sensitivity to something. Its mode of action, it works by competitively blocking our H1 receptors, which reduces the effects of histamine. Side effects are more common with fast gen, which is our Benadryl, and the side effects that we get with Benadryl is sedation and anticholinergic side effects. What are our cholinergic side effects we're going to see? We're going to have that drying effect, right? So dry mouth, constipation, urine retention, photosensitivity, and photosensitivity, dry eyes, right? So if a patient is taking Benadryl, our first gen, we implement fall precaution. Why? Because they are sedated due to the medication sedation. And that's it for our respiratory medication. You can check our other video series. Thank you for staying with me. See you on the next one. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.